I am Kayla Anderson. I'm a licensed addiction counselor in Sydney. We have offices for Prairie Hills Recovery Center in Sydney, Glendive, and Baker. Um, so far, I have 6 staff currently. That includes myself. Um, so we have addiction counseling that we do that's all outpatient. We help people with evaluations that are trying to get to inpatient treatment. We teach women's trauma group that has a lot to do with individuals who have been through trauma and their substance use is linked to it. We also teach partner family member assault classes for those who are in a domestic violence relationship and usually alcohol or drugs is involved. And so the city of Sydney has made us one of the places where they can go and complete those classes for partner family member assault. Most places do a anger management program, and it has been proven that anger management alone does not work. So we use the Duluth model. It is out of Minnesota, and it is primarily focused on different themes of violence, including financial abuse, emotional abuse, beyond physical abuse, sexual abuse. And so it uses a lot of different themes of violence that a lot of people aren't necessarily aware of. We also have moral recognition therapy. It is back in the day what used to be considered cognitive principles and restructuring, or CPNR, that was made in the prison system is no longer working. And of course, every time there is a change in legislature, they think they can do it better. So it is now the standard of the state to do moral recognition therapy, or MRT, or thinking for a change. To be honest, the thinking for a change curriculum is very expensive. Moral recognition therapy is not as expensive. So we went with moral recognition therapy. So we have that group as well that we offer. And we do we have a SUDS group, is what we call it, substance use disorder group. We also have a relapse prevention group that we do. So we have a lot of different groups that we offer. We also offer a 5-week financial class for a lot of our clients because they are struggling with rebuilding their credit, helping them, with bankruptcy issues, how long it takes things to fall off of your history, your credit history, and so we do offer that as well beyond just a regular budget. Trying to think if there's anything else that we do off the top of my head. I think that's pretty much it. But our primary focus is substance use disorder counseling, and we do the outpatient. We will help people get to inpatient. I know one of the questions that was asked was, where do we send people and why? Glendive used to have a 6-month inpatient treatment facility for fourth offense DUIs. So in order to get into that facility for 6 months, you had to have a fourth DUI. It was kind of like the mandatory sentence for DUIs. And then you would come out and do 5 years basically of probation on a fourth DUI after you completed that program. Now the laws have changed where if you get a fourth DUI, you can go to a program that is 6 months, or you can do treatment court. You're still on probation for 5 years most of the time, unless you have a really good attorney. So they took away that inpatient treatment center of 6 months because it was only for people who were fourth offense DUIs, and they made it into just a primary 30-day inpatient treatment center. And so now that is where we send a lot of people just because it's close. Glendive from Sydney is only an hour. Glendive from Plentywood is only about an hour and 2 hours and 20 minutes. So it's the primary one that we use. Everyone who comes to see me wants to go to Rimrock. I get it. But unfortunately, if you have Medicaid, the wait list for Rimrock and Billings is 6 to 8 weeks long. So if you have $20,000 cash, actually, I think it's $22,000 now. $22,000 cash or really good insurance, you can get in lickety split to Rimrock. But if you have Medicaid, you're going to wait 6 to 8 weeks. And by then, we know that someone does not want to go to treatment. The window to help somebody who wants to actually go to inpatient treatment and get help is about 15 minutes to maybe a day. Then they're going to go out and use again. They're not going to want to go they'll figure it out. Everything's fine. So the other one that we send a lot of people to is MCDC, which is the Montana Chemical Dependency Center. That one is in Butte. My record for getting someone into Butte at MCDC is 24 hours. During COVID, we took a lot of people there in the vehicle I'm currently sitting in. And because they wouldn't let them ride the bus, there was too much exposure to COVID. So we drove, I think it was about 16 people during that whole COVID time to inpatient treatment. So I put about 16,000 miles on my truck just taking people there. So those are the main places we send to. I have sent some to the recovery centers of Montana. I don't mind sending people there, but the chances of the person coming back to the community and actually engaging in outpatient treatment after they go to inpatient treatment and continuing with self-help meetings in the community, such as AA or NA, has been much slimmer if they go to recovery centers in Montana. I couldn't tell you why. I've read their discharge summary and it does say to do that, but for some reason, the people who come back from there just don't. So those are the main places that we send people to. The one in Glendive is actually called Badlands Recovery Center, and they do not do evaluations for someone to get into it at their facility. You can't just walk up there and try to get in. I know MCDC or Montana Chemical Dependency Center in Butte had that issue as well in the past. People would just show up on the doorstep and expect to get in. That's not how it works. They have strict protocols. You have to have an evaluation before you can get into inpatient treatment. They need to read through it, accept you. And the main reason they do that is because they're looking at someone's medical history. If someone has a long history of seizures and they're an alcoholic, the chances of you going into having seizures coming off of alcohol are very high. And when you're at an inpatient treatment center, they only give you a short detox time when you're at that place. They might have a little wing that has 2 or 3 beds in it, and a nurse is there all the time checking on you, but they do not get paid to do detox. So you might sit in there for 24 hours, maybe 48, and then you are strictly back to your room, and then you are doing, all the groups that they want you to do, the individual sessions they want you to do and participate in. So for someone that comes in to see me and wants to go to inpatient, wants to go to a detox facility first, I tell them there's no such thing because there just isn't. They almost want you almost clean by the time you get to inpatient treatment because they are not a hospital. They are basically, a couple counselors, a director, maybe a nurse, if there's any medications to be passed, something like that, but they are not a hospital. And I think people confuse that a lot. So they really do want you to have very minimal substances in your body when you go to treatment. They can help you through, giving you something to help you sleep. Usually it's melatonin. You get ibuprofen for pain. They're not a pharmacy, so they don't have a lot of medications to give people. I know one of the other questions was about the youth in the communities. We haven't seen, it goes in ebbs and flows, especially in Sydney. Like, in the summertime, we get more referrals for minor possessions. Usually around big holidays, Christmas, New Year's, and mainly the summer when all the parties start. But other than that, we don't get a lot of referrals for MIPs. Sydney has a curfew so that the young kids have to be at home at a certain time. And they also have a youth probation officer that will deal with all the tickets from all of the youth issues, like whether it's a citation for smoking tobacco, if they get an MIP, they have to report to that youth probation officer. So we don't see a lot of it unless the judge actually orders them to take a class or get an evaluation. Most of the time, they just put them on UAs, ankle monitors, and leave it at that. So I know in our school system, I'm on the board of our local advisory council. I'm also participating in a lot of other groups, and the consensus from a lot of the other places that deal with the high school is that the principal deals with things in-house. So I don't even hear about it if someone was caught drinking on a field trip or a school trip out of town for football, basketball, whatever, unless there was law enforcement involved and they got a citation, we never hear about it. So it's a little strange. It's kind of not fun, I guess, for I don't maybe fun's not the right word, but we never hear about them. And it's kind of sad because they could be getting education through the minor in possession class that we offer. You know, back when I was in high school, the people that bought alcohol for us were very concerned about getting a contributing charge. Now, I don't think that, I don't think I have not heard or seen them hand out a contributing charge for contributing to minors by buying them alcohol for years. I don't even know if they still do it. I think if they brought that back and started doing that more parents would be a little more concerned, or people who are buying alcohol for the young kids. Um, it's going to be the same thing, since they've raised the smoking age from 18 to 21, even for tobacco, for vapes, and all of this stuff. The kids are getting them from the home that they're in. I have kids that have come and seen me, and I know their parents from counseling the parents, and the parents have a history of melting down meth, putting it in a vape, and vaping it. And my concern is that when these kids get older, or when they start swiping mom and dad's vape, and these aren't just the little ones that you just take a couple hits on and then throw it in the garbage. These are the big ones that you can add in flavors, you can add in the different amounts of nicotine. I have clients who hide their marijuana use with that by putting in different flavors so it doesn't smell like marijuana. And when these young kids get a hold of it, it's going to be a problem going forward in the future. And it worries me a lot with all of the vapes. Recently, the Loaf and Jug in Sydney that I live by got bought out. It's now called Break Time, and they just got bought out a week and a half ago. They now have three large cases of every flavor vape you could think of under the sun, and a big neon sign in the window that blinks vapes. And that was not what that convenience store was prior to that. So it's becoming a bigger deal. And I think that our concern definitely should be for the youth of our communities because they're getting it from home. So normally for Prairie Hills Recovery Center for us, I like to at least see the person one time in person, um, because we've had, I know during COVID, it was easy to electronically sign. Everyone knows how to run the stylus now. But the other thing is like anyone could be on the other side of that forging that. And it's just better. I personally feel it's better to have the person in person to actually talk to me and discuss those things. Because there are some people that, they really want to get someone into treatment. They could forge their signature. It's easy to do anymore with things like that. And so I require your evaluation be done in person. And then I am willing to do um, telehealth with people. I've had people from Plentywood who've come down to see me. And then, when the weather's bad, we do a Zoom session like this. I've done phone calls. But the only hard part about that is it's hard to tell if someone is showering. It's hard to tell if someone is, smelling like alcohol when you're always on the screen. And so I don't like to do it full time. I will do it part of the time, but I like to see them in person occasionally because it takes away, you know, the one of the main things about counseling, like is the person put together? Like you can't see that on the phone and you can't smell if they've been around meth that kind of smells like cat urine if you're on the video call. So, it makes that part difficult to observe and see if they're doing well. But we do offer it. So usually I can get people in fairly quickly. It's within a week. If they call like on a Friday and I'm already booked for the next week, I will sometimes try and rearrange things. I'll try and do it after hours, and we can usually get people in within a week. Yes, I there was a gentleman I saw about 3 or 4 months ago, and he came in for a DUI on meth, and he was about 67, I believe. So it's happening. It's not just the young folks that are using substances or having a struggle with it. It's all ages. It doesn't discriminate. I think one of the other questions on that sheet was about treatment court. And I know that there's been talk previously of treatment court coming to Sheridan County. And I I think it would be great and I would love to have it there, but it has to be a decision of the district judge, and it also has to you have to have enough team players. You have to have a probation officer, a mental health counselor, an addiction counselor, a county attorney, a prosecuting attorney, the judge, and usually like someone from like the health department who can be involved. So it's a lot of players as well as a law enforcement person, whether it's the sheriff or an undersheriff or even, a city policeman. Um, so it's hard to get all those people at the same table at the same time. And we've we've talked about in our treatment court being able to expand it, because in the past we have had people live up by Outlook and participate in treatment court. We had a under agreement with the sheriff's office that they would do a UA on the person, and they were, I guess, trained how to do the UA. We've also had some people who've moved from Sydney or from Plentywood to Sydney to participate in it. We have clients who've been in Culbertson who have participated in our treatment court. So there is ways to do that. Um, but to start your own, it's a lot of work. I know the one in Sydney has been running since 2007, and Judge Bidigary is the one who runs that one. And we have a Department 1 and Department 2. So in Glendive, Judge Rieger is the one who runs the Glendive one, which covers a lot of Prairie County as well. Because the same probation officer that we have on our team is the same probation officer that oversees a lot of people who live in Richland County. Um, and it could work very seamlessly. Um, and then the other route would be to have the district judge. I don't know if Sabalski is running again. Or not. I don't know. But whoever the district judge is, that would be the other thing. And I think a lot of people don't realize that it is time consuming. The only person on our team that gets paid is our defense attorney. That's the only person. And it's like a small amount per year in the contract. Everyone else is volunteer. And so for like my staff, like we take about 8 to 9 hours a week out of two staff, like me and another girl. So like she runs the one in Dawson County and I'm on the team in Richland County. And so total between both of us, it's about 9 hours a week. So that's time we don't get paid for. That's time sitting at staffing, talking about the person, what resources can we get them connected to, let's make them an appointment, and things like that. Like it's a lot of free time you give up to ensure that someone can make it through the program. Our used to be 18 to 24 months, and now I think it's more on the 20 or the 18-month side or less. Um, there's been studies that have shown that it doesn't, keeping them in longer doesn't make their success any greater. So it is, then there's the treatment court conferences you have to go to every year. There's the statewide ones, there's a national one. So I mean, there's a lot that goes into it. Usually if they, like let's say they run out of money, they don't have enough money to buy alcohol or their drug of choice, and they're starting to go through withdrawals, they don't feel good, everything in life sucks. And so then they reach out, they make that olive branch reach out to somebody that they want to get help. And then miraculously, a friend comes by with their substance of choice, or they somehow scrounge up enough money to go get a small pint and they drink. And so then everything's not so bad. They were just, I didn't really mean to go to say I want to go to treatment, that kind of thing. So it it's hard to get someone to get committed unless their life, unfortunately, is truly in shambles or they have someone holding their feet to the fire. The chance of them wanting to go is not going to happen until they are absolutely miserable or court ordered. It can be, yeah. It's a shock for them to realize that just because they went to treatment and got better and got help, that not everyone, when they come home, has gotten better. Those people, you were just gone on vacation for a while, they're still there. And so to not have everyone around you being involved in some sort of treatment to be able to know how to help you properly, the chance of people relapsing is pretty high unless they're connected with some sort of aftercare, or we call it continuum of care now. This government likes to change up words every once in a while. So, they have to have that continuum of care when they get back to the community, whether it be, with Eastern Montana Community Mental Health or Prairie Hills, or, going to some meetings, just doing stuff like that. They need to keep that going. Otherwise, they're more likely to slip and go back to using. Not currently yet. So there is on the back of the Medicaid card, there is a transportation phone number, and that person can get reimbursed and submit all their receipts and everything, fax them in, email them into the state. But it's not like they're going to get the money the next day and you have to go there and come back before you can submit receipts. So it's kind of like getting reimbursed, but then, there are some people that would come home and think, oh, I just got a check after I got back from treatment. I'm not going to give that to my sister that drove me to treatment. I'm going to keep that for myself. It's free money, right? So unless you have family member or friends who are going to be able to drive you there, there isn't. Like the only reason I drove people was because during COVID, they didn't have friends that were sober. They had no family around. They had no money. No one in their family had a reliable vehicle, and they weren't allowed to ride the bus because it was too high of a COVID risk. And if someone were to got COVID at MCDC and then they had to shut down the whole thing, I'm sure a lot of people in the state would have been mad at my client for, riding the bus and trying to get there and getting COVID on the bus. So currently, there's not. I know that there is supposedly through the Montana Healthcare Foundation, there's supposed to be something coming about for things like that, whether it's behavioral health or transportation from one hospital to another for people. And so I don't know if that is something that would be included in that, because substance use is a medical need, it's a medical disease. So I don't know if that would expand out to that or not, but I know that that's something that they are working on. Um, the Montana Healthcare might not be foundation. They're doing stuff like that. Well, prior to the governor deciding he wanted to be one of the first states to get rid of the excess funding in COVID and redetermination all the Medicaid, it used to be fairly easy to get somebody connected to Medicaid. Now it takes a little bit longer. So at our office, people can come in with their information. It takes about 30 minutes to apply online. It's at apply.mt.gov. I will say this, you have to have Internet Explorer. You cannot use Chrome. You cannot use Safari on a phone. None of that stuff. It has to be Internet Explorer. And so that has been a hurdle for a lot of our clients who think that they can just go and apply on their phone and it's some track phone with Safari or whatever on it and it's not working. It boots them off. So you have to have it on a computer and do it at an actual computer or laptop. And so once you go to that website, it takes about 30 minutes. It's very easy. Yes or no questions, their address, social security number, phone number, email. They make a password so that they can log in and check the status of their Medicaid. It also works for Medicaid, TANF, and SNAP. And it's all electronic. And I get why the state wants to do it that way, but I've had faster results faxing in a paper copy, to be honest. And you have to ask the state to have a paper copy. They don't just have a place on the internet where you can go and print one. You have to have them email it to you, and it's a nightmare. But it's fairly easy to get it. The longest I think I've had somebody wait to get their Medicaid is about 3 to 4 weeks. We can back bill that if the person puts on the form that they fill out, there's a question that says, do you want your health insurance coverage to go back 3 months? Everyone needs to click yes on that because otherwise I or Eastern Montana or anyone else just did all that work for free. And then they're going to come out and they're going to get a bill because they didn't check that box. So yes to the insurance going back 3 months, and then they can apply for any of the inpatient treatment centers, or if they want to do outpatient in the community, there are those options as well. They want to go, we get the eval done within like 2 or 3 days. We get all the stuff sent off. It might take, a week for them to be like, yep, we're going to get you a bed date. It's going to be 6 days from the day we got your application. We looked it over. And by the time that comes, they go, I don't think I need it. And then what I see happening for my clients who struggle with that is fast forward probably 3 or 4 weeks, they usually relapse again. So when my clients tell me, I don't want to go now, I'm good, I don't need it, I say, well, as soon as there's another bout of use, that's still my recommendation and I will recommend you go. You're more than likely, you're able to say no at any point. I always tell them that. But I am also allowed to fire you as a client. So no different than a doctor can fire a patient for not following through. Like, let's say someone had a heart attack, they don't want to have them keep eating salt and smoking cigarettes and drinking and da 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 da. And if the client keeps coming in, nothing's changed. They're not following the diet. They're not doing what they're being told to. The doctor can fire you as a client, as a patient. So I always tell my clients, like, if you don't want to go and you use again, my recommendation still stands. And if you want to go to Eastern Montana Community Mental Health, you want to go somewhere in Williston, which usually doesn't happen very often because most of the ones who have that problem are Medicaid and you have to switch Medicaids to go to North Dakota. So my experience is they'll either go or they won't. And if they use again, I say, this is my recommendation. If you don't go, I'm not going to keep seeing you.
Mm-hmm.
Yes. Well, I started out in business actually. It's going to be the female Donald Trump. Didn't happen. I got bored with it because I took a lot of the same classes in high school in Plentywood, and I had to do a whole another year of Word and a whole another year of PowerPoint. I was like, you know what, this is ridiculous. I already did that. So I switched when I went to Billings for a while, and then I went to Williston, and I went into a program called Addiction and Mental Health Technician, and I loved it. And um, then I went on and got some more schooling and went back to Billings and got my degree. And so, yeah, now the state is actually changing it from a 2-year degree to a 4-year degree. Everyone who finished this year, graduating time, they now are going forward. It's a 4-year degree to become an addiction counselor. I think, Dawson County in Glendive has, a whole program that they have down there. And I know the lady who is one of the instructors and the advisor for that program. And she refers a lot of them to me just to kind of get their feet wet, do a little internship while they're in school. And then I've had some of them come out and want to go to North Dakota. Some of them have stuck around. Some of them went to Billings, to Rimrock to work. And so they have a good program there.
Thank you very much, Kayla, for doing this and taking that extra to join us.
Anytime.
Thank you.